Preventing readmissions holds major potential for improving patient care while reducing costs, but tracking discharges has traditionally been difficult to manage, and trends in preventable utilization can often go unnoticed. That's why we're here speaking with Dr. Martha Rodriguez from MMR Healthcare here in Boynton Beach, Florida, about how her practice has been using the transition care management tools from eClinicalWorks to facilitate those efforts. Dr. Rodriguez, thank you so much for being here. Tell us a little bit about your practice and why transition care management is so critical for your patient care.
So our practice is a primary care physician practice in Boynton Beach, where we treat mostly chronic conditions, mostly geriatric patients. And in our practice in particular, we have a big set of tools that we use to track patients, identify them for their risk, identify them when they have issues of hospitalizations, and follow them to avoid readmissions.
If we're looking at utilization overall, across the nation, what are some of the trends that we're seeing that we're trying to impact here?
So the trends that we're seeing is that we're not getting anywhere. So unless we coordinate and get together and use data, point of care data to change outcomes, we're seeing that we're not making much progress. There's some serious conditions that keep repeating themselves just because we don't utilize the data that is available to us to change those outcomes.
And is there a readmission rate nationally? Is there a national readmission?
The readmission rate nationally is about 18%, which is very high.
Now, many practices don't get reliable notifications from their hospitals, and so tracking and managing TCM is a bit difficult. What is the risk for practices and patients if they don't participate in TCM?
Well, the risk of not participating in TCM, the number one risk is that you're a major financial loss, both for the practice and healthcare. Because if you don't identify the patient when they're hospitalized, you cannot change the outcome of that hospitalization or prevent a readmission. And two, the whole thing can be more costly because there's a disconnect among the team.
What is your office doing to overcome that first hurdle and figure out when patients are being discharged?
So we use a tool that we have available to us. It sends us a message. Anytime the ID of the patient hits a facility, we get a message. And that immediately starts a process in our office where we involve the patient in the TCM program, and we follow the patient throughout their admission. There's a team that is involved. We have a person who calls the patient at the hospital every day, documents in the tool all the notes of the conversations for everyone to know. If the patient had any procedures, any medication changes, everything is documented, and the patient is followed throughout the admission. Once discharged, we use the tool to bring the patient back within limited time that we need to, so we don't lose the window of time that is important to prevent the readmission. And as you know, there is a punishment that is going to be carried through if the patient is readmitted within the next 30 days following admission. So we put the patient in the tool to track them through the 30 days so that we avoid any of those problems.
Was your office participating in transition care management before you started using the eClinicalWorks features available?
Yes, we've always done transition care management in our office. Not necessarily built for it, because we ourselves didn't know the value of the financial value of billing for it. But we looked at the bigger picture because we have a big managed care practice. So we looked at the millions of dollars that can be saved by doing transition of care at a global basis. So since we have learned that, we have always followed the patient from admission to discharge, following discharge. The beauty of the tool is that it's one-stop shopping. In the past, we had a patient that took care of the hospital calls. We had a pharmacist who took care of the MTM, or the reconciliation post-discharge. We had the front desk scheduling the appointment, and not necessarily everybody knew what the other person was doing. Since having the tool and having everything in one place, the efficiency, the cost of doing it, and the outcomes have all been improved.
So there's a benefit to be gained in the healthcare system. We're saving money overall, but it sounds like there's also a financial benefit there for your group because you're able to manage that so much more effectively. Now, what kinds of targets has MMR Healthcare set for TCM? Where did we start out? Where are we now? and what is your goal going forward?
My target has always been to beat the country's readmission rate. I think that we can do that, and we've proven to be able to do that using transitional care. The national average is about 18%. Ours is about maybe 10, 12%. And we could have never done that had we not identified the patients that needed to be followed from hospital day 1 to the 30 days following a post-discharge with a system that created the collection and the management of the information.
In what ways has having the TCM dashboard improved your ability to manage patients in that very difficult time? What kinds of strategies are you putting in place? What are you learning from the use of this module?
Oh, to our surprise, and even though I claim to be very educated, with the TCM, carrying TCM, I learned very quickly what were our targets. For instance, we found out that CHF, falls, flus were one of our biggest problems for admission to the hospitals. Using that data, we created a CHF clinic in our office with the use of Nova University staff, which is in our office, the pharmacy school, and we created a CHF clinic. Since we started with that clinic, we have never had another readmission for CHF. The tool helped us identify which were the diagnoses that were most important to target, and therefore we were able to modify them.
Now, you mentioned a partnership with Nova Pharmacy School. Tell us how that fits into your strategy here at MMR Healthcare and what that partnership looks like.
So we got recognized for PCMH back in 2014. And PCMH is a recognition that comes from proven excellence in teamwork, which is how I've always practiced. And I've always known that the pharmacist is a key player in a team of patient care. The patient being the leader, but the pharmacist is really important because the pharmacist is the one that carries through the medications, and those can change everything. So since we learned that, we partner with Nova Pharmacy School, and we are satellite for their school. Their students rotate through here, and we have Dr. Genevieve Hill here in the office twice a week. She's a professor at the pharmacy school, and she leads the CHF clinic and the hypertension clinic, and they see patients just like we do, and follow patients in between our visits. Whatever is needed, they call the patients and make sure they've done their refills. They check to see if they're having their insulin, for instance, done properly. They educate them on the use of insulin. If needed, they pre-fill the pill boxes. They bring the patient in and do a pill box for a month so the patient doesn't have to do it. Whatever need we identify, they're able to help us to carry it from the pharmacy perspective.
It sounds like you're really hitting home that idea of collaborative care, making sure that everybody who's involved in the patient's care is well aware of what's going on with all of the other parts. And it sounds like that's making an impact. Can you think of a particular patient story where transition care management has really made the difference?
Well, we have many stories, but we have one and it's one that I like to talk about because it's such a frequent one. Most people like to go out to eat on Friday nights, and a lot of people go to Chinese restaurants on Friday nights. Well, we all know the amount of salt that can be, nothing against Chinese food, but it's high in salt. So people are at risk for changes in volume, like CHF patients. It can cause them to go into a crisis because they go to a Chinese restaurant. Using TCM, we were able to identify patients at risk for volume issues such as CHF, and we were able to create programs to change that. We educate the patient on what to do before going out to eat. We educate the patient on what to do on the next day after eating. So we have found that by giving them emergency kits, for instance, like giving them a water pill to have at home before they go and to weigh themselves the next day and use it if needed, all of those things have changed everything about the patient's admissions.
How critical is a team-based approach to success in transition care management? And in what ways does the transition care management tool facilitate that team-based care?
Well, I believe that healthcare as a whole cannot be accomplished well without a team effort. It really has. We all know that, for instance, LeBron, isn't he a star basketball player? Can he win a championship by himself? He can't. So no matter what I know, I can't do it all. I can see the patient, I can educate them, I can transfer my passion, but I cannot go home with them. So a team is critical to carry through what needs to be done in between visits. And the team players are very important. And we need to recognize that. But what we really need is one place where all the teams can put their scores. You know, you cannot be in a team playing a game and there's 10 different scoreboards. That makes getting to the final score very difficult. With the usage of a tool, we're able to record everything in one place and the whole team can see it at the same time. That's transforming.
Now, transition care management is often looked at as maybe being retrospective. The patient was in the hospital, they were discharged, now we have to care for them. Are there ways in which this tool is helping you to be proactive in care for your patients?
Oh, absolutely. For instance, one of the frequent reasons for admissions to hospitals in the elderly is urine infections. So if a patient is admitted for a urine infection and we identify that in the tool, we put a system in process that we, for instance, may give a patient a suppressive therapy with an antibiotic. So by identifying that this is a problem, using the tool, then we can create a program to eliminate it as a problem.
Excellent. Well, it sounds like we're really pushing the envelope with patient care, really improving those outcomes and reducing readmissions. Thank you so much for your great work, and thank you so much for your time speaking with us here today. If you'd like to learn more about the Transition Care Management module, check out my.eClinicalWorks.com or speak with your strategic account manager. And check out our other episodes on iTunes, YouTube, and my.eClinicalWorks.com. For the eClinicalWorks podcast, I'm Adam Salati. Thanks for watching.